SCAGO's Learning for Life, Career Fair, and Art Showcase all in one.
Hey, my name is Andrew. I'm part of the Youth Empowerment Program here at SCAGO. I'm here at SCAGO's Learning for Life event. I also helped organize a project at McMaster, an educational event involving Dr. Verhovsek, as well as Ufuoma, two speakers to educate our medical students and undergrad students on sickle cell disease. For this event in particular, I love the personal stories that I heard from our speakers as well as all the participants that joined us today. And I think one of the greatest skills I learned from this project was on leadership skills and how to organize my own event.
Hello everyone, my name is Chloe. I am the Communication Coordinator with the Sickle Cell Awareness Group of Ontario. Today we had an incredibly exciting event featuring our in-person Learning for Life with features of our career and future pathways. What does that mean? It meant that we had incredible speakers. It meant that we had booths from different employment as well as opportunity organizations. We also had an art feature where individuals from the sickle cell disease community submitted their artwork about what it means to them being part of this community. So overall, it was a collaborative event with Black Creek Community Health Center, and we've learned so much from the community. Lots of food, lots of fun, and something that everyone should look forward to for future years and future experiences.
So hi, this is Cheryl Prescott, the Executive Director here at Black Creek Community Health Center. And I'm so happy that we're having this collaboration today with the Learning for Life initiative, which has brought resources, the job fair, and information about sickle cell disease to our community. We have a long relationship with SCAGO. However, we don't always have a chance to meet in person, and it's great to hear from our community, from the experts in the field of sickle cell disease, from clients who are living with sickle cell disease, and it's a great learning for myself and for our staff and for the community members. So really happy to be part of this event, and it's, from what I see, the room is full and everyone is having a great time and now enjoying some great food. Thank you so much for the partnership.
Hi everyone, I'm Peter. I'm a community health worker at Black Creek Community Health Center. We're here to support the SCAGO initiative. We have a range of groups and programs that individuals with this disease can sign up for and receive supports, from employment supports to health groups and health supports.
Hello, my name is Nafanta, and I am part of the Youth Empowerment Program. Right now I'm at the Learning for Life. I truly enjoyed working with the Youth Empowerment Program and the SCAGO team. One thing I've learned and truly enjoyed is the fact that they fostered a sense of community amongst us as youth with our bi-weekly workshops. And I've also got in touch with my network, built stronger bonds, and was able to put on events that I'm truly passionate about and supported a community that I hold close to my heart. So you should definitely join the Youth Empowerment Program. There's lots to learn, there's lots to do, and I can't wait to see you in the next cohort.
My name is Lola, and I'm here at the SCAGO Learning for Life event as part of the SCAGO Youth Empowerment Program. Over here, I've curated a gallery that's filled with art that are submitted by individuals with lived experience with sickle cell. So these are individuals who have sickle cell themselves, who have a loved one with sickle cell, and it's essentially their way to express their experience with sickle cell through visual, artistic mediums. And so as part of this, we have both an in-person and a digital gallery. And participants are able to view the gallery, come interact with it, come hear from people with lived experience from sickle cell, and at the end they have the opportunity to vote for their favorite piece, the one that they resonated with the most, and the top 4 selections will win a prize. And so this has been very meaningful to me because I've had the opportunity to really hear from those who have sickle cell or who have lived experience with sickle cell, just more about what it means to them and their experiences.
And so I think as someone that has lived with sickle cell disease, understand the challenges of sickle cell disease, I think one thing that they need to take away is know thyself. Understand what it is that about your disease that might make you feel sick, might make you not feel so well, and then creating those networks to address those challenges, making sure you're surrounding yourselves with individuals and with systems that can help you with that. So that includes making sure you have doctors that understand who you are and how to address your needs, but also understanding what are those other systems within the school system, within employment systems that can help you live your best life. So it's very important as an individual with sickle cell disease, know thyself, and then be able to explain and work with others so that you can become the best version of yourself. Okay, hello everyone. Thank you so much for joining us today for our Learning for Life and Career Fair. We're gonna go ahead and get started. My name is Donnell Ivy. I am the Education Coordinator for the Sickle Cell Awareness Group of Ontario. I'm also a doctor that lives with sickle cell disease. So I'm glad to share with you some of the things that we can do to help individuals live not only a longer life with sickle cell disease, but also a more productive life with sickle cell disease. We don't want to just increase life expectancy, we want to improve that quality of life for individuals as well.
My name is Patricia. I am a second-year pre-med at the University of Ottawa. I'm living with sickle cell. I am in the health sciences program, and now while I'm studying in Ottawa, I live in London, Ontario, which is going to be relevant as I discuss the processes and challenges of post-secondary education with sickle cell when you go to a school so far away from your hometown. In August 2024, when I saw my regular care team right before I left for Ottawa, they made it a point of making sure we established two things that will be the two key points I will be speaking on today. One is a split care team between them and the Ottawa Hospital, and two were academic accommodations. I'm going to start by briefly talking about the split care I have been receiving from these two hospitals, before going into what I think is a bit more relevant to today's discussion, my accommodations. So now, what is split care? What it essentially means for me is whenever I need to schedule an appointment, call for a prescription renewal, or get a test done, I do it at whichever hospital in whichever city I am currently in. Moving away for school, I ended up receiving care from the Ottawa Hospital and LHSC, London Health Sciences Centre in London, Ottawa. And now it can be difficult communicating with hospitals as is, let alone communicating with two and trying to get two hospitals to communicate with each other when handling your care. So the challenges, I would say, that affected me most are test results, for one. Imaging and treatment plans not being shared between each hospital, and even more frustrating is the inconsistencies, because sickle cell already comes with so many inconsistencies. Most people make the transition from pediatrics to adult care as they are graduating high school and therefore going on to higher education, which becomes much more difficult when you don't have a consistent care team and your providers are split, especially when you move on from pediatric to adult care. Something I found really helpful are patient portals. Now, while LHSC doesn't have a specific patient portal, the Hospital of Ottawa does, and it lets you log in, see your own lab results, current and future appointment dates, and directly call the hematology clinic, which makes it a lot easier to keep track of information when you have two different hospitals. Now, when it comes to academic accommodations, I simply wouldn't have any without my medical team at LHSC, and by that, I don't just mean I wouldn't have had a doctor or an NP to sign paperwork. I mean, I wouldn't have even gone out of my way to realize how much I needed them, and I would have had no idea where to start. I don't want to turn this into a lesson on how the University of Ottawa's accommodation services system work, but this is just a quick screenshot of part of my Ventus dashboard, which is the name of the accommodation portal we use at the University of Ottawa. This is basically the hub where everything happens, where I can see which accommodations have been approved for which class, where I can manage things like scheduling stuff for the exam center, and where I can book meetings with my learning specialist. Something I really appreciate about the Venta system is that it takes pressure off of me having to communicate with my professors. It immediately sends them information so that I don't have to relay it over and over and over again. Now, before I go more into that, I want to say I did not have any accommodations in high school. My high school was a bit smaller, and we only had one teacher who was in charge of that program. I asked for accommodations September, beginning of my 12th grade year, and by May, I still didn't have them, and I was going to graduate without them. But even with Ventus making things easier now that I'm in university, the process isn't as smooth as it used to be. It feels overwhelming having to figure everything out, especially at a certain pace. But my professors don't need to know every detail of my health history. All they need to know is that I have a physical chronic illness, that it's permanent, and that it has been confirmed by specialists. One of the biggest accommodations that have helped me with flexibility and deadlines is increased due dates. Sickle cell crisis do not happen on schedule, and they definitely don't wait until after midterms. There have been times where I have actively been in bed recovering from a crisis, and I've had to email a professor with my letter from my learning specialist about my condition. Another part of accommodations that have been incredibly valuable is being able to record lectures, whether I'm there or not, in case I miss them because of a crisis. Now, while I managed to gain a lot of accommodations and a lot of help through my own school, I know this isn't available to everyone as much as I wish it is, but managing appointments, prescriptions, and crises on top of group projects, deadlines, midterms, and everything else isn't easy. And I hope that with Dr. Newton and Io's presentation, we all learn about more we could do to help sickle cell warriors. Thank you.
Okay, but we have the presentation here, but I'll just be talking about my experience. So the presentation is here for you to go through, but I'll just give you a background of how I was able to help my son. He's in grade 7 in the Durham Catholic School Board, and he came into Canada. Well, he wasn't born in Canada, so as an African, back in Nigeria, the weather condition is different. And when he came into Canada, I, did a little schooling to the school to tell them, oh, he has sickle cell, and just a little. I expected them to know what sickle cell was all about and how to better manage this the boy. But unfortunately, he came before the winter. So during the winter, I started hearing him say, I have chest pain, I have, pains that never existed, even being a sickle cell child. And he kept complaining and, talking about this pain, and I'm like, this hasn't happened before, what's going on? So I just asked him, give me the background. Tell me what's happening in school, what do you do, how do you go about that? And he told me he's always going out on recess. I'm like, what? So I just came to the school, and then I told them, do you know what sickle cell is all about? And then the principal said, yeah, I kind of understand some things, yeah. I'm like, you know what? Can I bring my team in SCAGO to come and talk to you guys about sickle cell? And the principal was really kind enough to say, oh yes, we'd like to know more about sickle cell disease. And before then, he usually go for bathroom breaks, so the report would come, why are you always going for bathroom breaks? He's a sickle cell patient, right? So okay, SCAGO came in, we got a doctor to come in to talk about sickle cell, all the things that happens to sickle cell patient. Because in all honesty, you cannot treat A as B. You have to treat each child differently and their needs differently. So they didn't know what to do when he complains about things and how not to. So after we did that training, it was really educative. It was like the principal was surprised that, oh, these are the triggers that they've been seeing, but they did not know. So if I as a parent did not go that further to educate them, a lot of things might have gone wrong. And unfortunately, after that training, 2 weeks, just 2 weeks, my son slumped. And they just had to call the EMS. They called me. I've never had that experience before, like never. So it was like, oh my God. You know, because all the backlog of what has happened to him, they did not pay that attention to him. So everything was coming out. But good that they were able to solve the situation. It was easy for them to, okay, call the EMS, call the parents, and, you know, help him out with what was going on, because they saw that those triggers, it was like a forced seizure and all of that. So after then, the school always calls me, like every second, every second to say, okay, he's going this, he's doing that, is it okay? He's going, because, you know, as a child, he's 12, and, you know, he wants to go out. He wants to have fun with friends. He wants to play basketball. He wants to do a lot of things. Yes, you want to do it, but you have to know when to stop. Giving them that leverage, giving them that support in loving way, even sometimes harsh way, every way that you can really pass that information, because once they're growing, you have a lot of things that is going to happen to them if those medications are not taken at the right time, and just because they are not aware as a child. The child will always be a child, but we as parents will be able to help them to navigate towards getting that better health care, even in the school.
So I wanted to just talk about strategies for success, and of course this is not exhaustive, but I think there are a number of things that I hope can be helpful. They come from literature, they come from the people we meet at SCAGO, where I'm part of our psychosocial team. There's counseling being done, there's meeting with hospitals, there's meeting with schools and workplaces. So I hope you'll find it helpful. So I just wanted to start with this notion of what adjustment is. And I know we think of adjustment in lots of ways. We adjust the fit of our clothing, we adjust something in a socket so the light bulb burns brighter. But when we talk about adjustment as a health principle, we're speaking about actually adapting in a helpful way to one's health condition and living as full and complete a life as possible. As you might imagine, if you know anything about sickle cell disease, there's a lot to adjust to. So adjustment can be quite an undertaking. We know that sickle cell is lifelong. Once you're diagnosed, you're living with it. You are going from birth through the end of your life with this condition, and it will change in its presentation over time. That said, each person's got a unique experience. Even though we have documented symptoms, that's how we get diagnosed, we also have individual experience to think about. The great thing about treatments and things that have come along, even within the last, I would say, could I say the last century? I guess we're looking at that, means longer lifespans for people with sickle cell. Having the diagnosis no longer means, shortened lifespan necessarily. It is challenging at all stages of life, especially for those with severe disease, however, to eke out that normal and healthy and happy life. But that said, people are living longer. Treatments are a big reason why. Greater awareness is another big reason why. That's why something like SCAGO exists. And of course, we have better access to a range of support. And that can be of a medical nature, that can be other types of supports that are provided. An interesting thing about a lengthened lifespan and more possibilities is that folks that maybe were once told, don't plan for the future, you'll be with us a little while and we just want to keep you comfortable and happy. Don't make goals, don't set aspirations, don't think too far ahead, almost trying to keep one safe from disappointment and possible loss, has shifted. Now it's about No one's saying it's going to be easy, but understand that planning is essential for anything that you need and hope for. And it's okay to plan, and it's okay to adjust our plans as things come along and to cope in that way. So it's an interesting time to be alive, and an interesting time for those with sickle cell to be thinking about what's ahead for them. I'm thinking that folks are here today because they have a young person in their lives, or they themselves are moving forward with their goals. So I hope that you'll find some of what we talk about helpful and think about how it applies to you. And of course, we'll be around afterward if there are individual questions, okay? So about that idea of thinking ahead and goal setting, it always involves planning, and I think that the theme, no matter who you hear from today, is going to be doing that early and often. You can't start planning too early. With newborns, people are thinking already about their university and college tuitions and saving for that. Likewise, at any point that you decide that you want to embark upon something, that's the perfect time to start. There's a saying that says, I think it comes from an ecology organization or something like that. But it says the best time to plant a tree is 100 years ago, and the second best time is now, today. So we want to think about what's in our hand, and we want to make plans that are reasonable and attainable. So with that, just wanted to mention some of the things that we know help everyone, regardless of their health status, and that is centering hope. I'm sure people here understand that when sickle cell becomes very hard to deal with, maintaining that hope is extra difficult, and I would argue extra necessary to lean into what can be and to have those around you remind you that life can return to a degree of normalcy. That hope is what helps us move forward and make the plans I'm talking about. Also here is prioritizing your wellness, making it your job, and in many ways it is, to not only understand your health condition well, but to help others around you understand it, such that you receive the support you need in a timely way. Strengthening communication of needs is a big one. I think that it can be difficult, and I'm getting this firsthand from folks living with sickle cell, that it's hard to ask for help. It's hard to say I'm somebody who's living with this and I need something different maybe from my sibling or somebody else in my class or at work. At the same time, without that communication, chances of change are little to none. So we need to be able to communicate things in an effective way that helps people understand. We need to keep communicating as our time in that situation goes on, so that as our needs change, others know what we need. We need to engage with healthcare teams as folks living with sickle cell, because of course it's a condition that requires medical treatment at different points, or in some time periods rather continuously. So having some of that communication extend to healthcare providers is huge. People do form relationships with their healthcare teams by necessity, and some are stronger than others, and so that's an ongoing task. Getting to know who's looking after you and making sure they understand who you are and what you need and how you can work together. I will put in a plug for our well-being coordinators like Samira for the GTA and others in other parts of the province who are key to some of that communication of what we need. So just a reminder that we're here to help with that. But that communication about what we need is instrumental in providing some of the timely and needed supports that folks have. And as I spoke about adjustment off the top, which is being able to cope well and live well with the condition, you need all of these ingredients to do so. So I share that with you to consider. I thought knowledge is power might be a nice way to title this slide, just because it's an overused one, but I like it. And knowledge is power, because the more you understand about what you're coping with and how it shows up, the better you can educate those around you. And likewise, the way that you leave that learning and knowledge wherever you are and where you engage, the better it is for those that come after you. So it goes without saying that understanding your particular health pattern is important. It may not be what another person with sickle cells is. And once you get a sense of patterning, which happens over time, you're able to do some predicting. Many folks will say, I know exactly when I'm going to have a major pain episode. I know exactly when I'm coming down with something and that I need some medical support. And that helps them to respond quickly rather than much later in a sequence where chances of complications are higher. Right? So we want to be able to think about and attend to those patterns for ourselves. Parents are especially good at doing this for their kids. Sharing a diagnosis often leads to what we call accommodations or supports in the classroom. That can be extra time for an assignment or other work item. It can be different ways of submitting work or completing a requirement. It opens up flexibility, but it requires knowledge that the condition exists. Development of learning plans is a huge part of the support that a person may draw in an educational setting, especially. You heard about the individual education plan, or IEP. That's common to every school board for elementary and secondary students. And sometimes it's about the physical needs of a young person, but sometimes it's also about the learning ones. Sickle cell disease is linked to learning challenges for a proportion of youth. And so there may be a need for math help. There may be a need for extra time or memory aids and things like that. Those assessments are important, and they open up possibilities at the school level, at any school level. That communication with teachers and professors needs to be early and ongoing. Patricia shared with us that she presented her information to the accessibility office at her university. Again, they don't come looking for us. We need to let them know that we're on campus and that we need things. And Patricia, would you confirm that's done well before the school year starts? Yeah? Right. Patricia did this 2 months early. I would tip my cap to her because I'm meeting folks this month that are scrambling, but you did it ahead of time, and I think that's a really good model to follow. Sometimes there are letters that are needed to support this. There's always documentation needed, but as Patricia also said, having the accessibility office or even the school administrators aware of a student's needs means that there's a central person who puts that information into the hands of those who need it most, rather than making that now another task for the learner to have to do. At work, an accessibility plan could include something like temperature controls, so you're not working in a cold area or an overly heated one. The ability to work in a hybrid manner, home or in the workplace. Again, we can't unlock these things without letting folks know that the need exists. Socially, there's a disclosure to friends and family too, right? And I think there can be a lot of hesitation to do that for reasons that we can all understand. That said, what would it be like to have less anxiety about the times that you're unable to be in school or can't join the friend group, because people will understand why you're not there? And what about the possibility of increasing the support that others can offer you? And I really do think that most people will want to if they know. So it's always everyone's decision, but I think there's a lot more in favor of sharing than holding on to that information. Even in this room, I would say that we have a number of people who are potential mentors and supports and advocates. In fact, I think everyone here has a role in advocacy. Certainly at SCAGO, we've been doing that for a long time. We just had a big anniversary, actually. And we would be among those organizations I'm referring to in the first bullet that are able to support across the lifespan, from childhood all the way to senior years. And although connections with services can be either once or they can be ongoing, they have to start. So again, that message that you do need to disclose, you do need to be able to engage and then get that ball rolling by starting things out, by asking for help. I've mentioned some of the ways that school and health teams can help. Their documentation is important to activate support, but they can also be present at meetings. I think care conferences are very helpful, whatever your stage, if there's a challenge around getting the learning needed done. We have well-being coordinators at SCAGO. I mentioned that Samira is our representative for GTA, and we have folks in other parts of the province as well, but there are a number of ways that they are advocating all the time. People may be in an inpatient or outpatient situation and needing help with their care and getting some of those standards met. It can be about locating services in the community. Many of us need funding, disability support, support for children that have significant healthcare needs related to sickle cell. So being able to find the services needed and applying for them, which can be quite a lengthy and challenging process.
We didn't have a long life expectancy, but that has improved over the years, and now individuals living with sickle cell disease can expect to live into their 50s and longer. And so we have to figure out, well, how do we help individuals with sickle cell disease that are going to live that long life, have a productive life where they're able to succeed in school and then go on to college or go on to a job that will help them to live a very productive and fulfilling life. And so we know that there are gaps in the school system that we need to address. And those gaps can be due to a lack of knowledge or a lack of awareness about sickle cell disease. As Ao mentioned earlier, when she first interacted with the school system, they were diagnosing it as cancer, or they were telling her other things. And so she had to take that proactive step to go and educate the school system. She also mentioned that the school system itself, if you have individuals that are participating in gym and it's cold outside, or if you have individuals that are doing other activities, that can lead to crises. So helping the school environment understand, well, what are those situations that can cause a crisis to occur? I have here that one of the gaps, or one of the things that we have to keep in mind, is poor academic performance. Now, individuals with sickle cell disease can be at risk of things called silent infarcts, and these are mini strokes, small strokes that can happen in the brain, and that can lead to changes in their ability to pay attention, changes in their ability to do well in school. It's not that the student can't learn, but they may need other resources to help them to do better in school. There's also a lack of data. We don't know how many individuals live with sickle cell disease in the school system. We need to have that information. But as Sandra was saying earlier, SCAGO can't get that information without your help. You have to self-identify. You have to let us know, hey, you're here. You have to then talk to the school system and let them know, hey, I'm here. I need these resources. And then we want to work with you to gather the data. What is it that helps those individuals with sickle cell to do well in school? What are those gaps that we continue to have? As I mentioned, we do have food. So please go into the back to get yourself some food. Please visit the vendors around the table. Please complete the QR code if you have not done that yet. You will need to show that to the table to get the other card. But everyone, I'd like to thank you so much for attending our event today.